We've got a question here which says, do all implants need replacing after a certain length of time? Good question. And it's a bit of a myth, really, I think, because a lot of people think they've got to be changed every 10 years. But they don't have to be changed every 10 years. And so the answer to that is they don't have to be changed after a certain length of time, no, because the main thing that happens to them, and the main reason you might want them changed, is the capsular contracture hardening around the implants. Now they say well, it's not they say, I think it's true, that the person who first had implants ever in 1960, whatever it was, has still got them in. So they don't have to be changed, but they're probably hard. So they go hard, that's capsular contracture, and that can happen. I normally say around 5 or 10 years. You should sort of plan, I guess, around 10 years plus or minus to have them changed, because they might go hard and they might go unsightly. I should have some implants here. They get squeezed and they look round, and they can look unsightly and they can get uncomfortable. That's the sort of history of capsular contracture, and that might require you to have them changed. The other reason, which is less common, is rupture. There's two types of rupture: intra and extracapsular rupture. And an extracapsular rupture is a road traffic accident where the whole thing the breast becomes misshapen, the capsule and the implant ruptures, and you get silicone in the breast, which can cause irritation and things. Intracapsular rupture, again, more common. Sometimes a silent rupture, you don't even know it's ruptured. You can just pick it up on a scan, and that's another reason you might want to have them changed. The problem is, or word of caution with that, is that no scans are 100% either way. Scans can sometimes say they're ruptured and they're not, sometimes say they're not and they are. I just operated on someone yesterday who I think they said both. The scan said both were ruptured and neither were ruptured. So and it works both ways. So scans aren't 100%. For that reason, I don't routinely scan patients. I'm going off the question here. Blimey. So yeah. Anyway. Well, no, it's sort of on the question, isn't it? Do they need to be replaced? Yeah. God, my haircut. These. So they don't know. They don't need to be replaced. And the bottom line is, if you haven't got a problem, I wouldn't worry about it. If you're not symptomatic, if you feel that they're fine, then they're fine. Personally, as I say, I don't routinely scan them. Some people want peace of mind having scans, but then if the scan says it might be ruptured, it's not 100%, then you think, what do I do? Because I'm happy with them. And then you run the risk of having further surgery, which does carry with it risks, which may not have any benefit, because it might not even be ruptured. So I think we've got that nailed, that one. Do implants need to be replaced after a certain length of time? No, but I would, if you're having implants, I plan to have them in. I plan that you may well need another operation. The other problem with the other operation, so if you have the capsule removed, another capsule comes quicker second time around. It's more expensive than the first operation because it's a bigger operation. So it's something to consider. And that's where the polyurethane ones come in. They've got a lower rate of capsular contracture. But anyway, that's something that you can consider.